In today's Health Nugget, we are going to continue looking at those 13 steps that you can take to reverse your diabetes. And the step that we will look at today is step number 2, eat whole plant foods. Whole plant foods are foods that come from plants and are eaten in the form they grow in or have been minimally processed. For example, boiled or baked potatoes would count as whole plant foods, but French fries or potato chips would not. Brown rice, corn, and barley would count as whole plant foods, but white rice, white bread, and pastries would not. Preparing your foods with seasonings and herbs is fine, but avoid preparing your foods with oils, margarines, condiments, sweeteners, or other fatty or sugary additives. The following is a list of whole plant foods in the order of how they impact your blood sugars from least impact to greatest. 1. Raw green leafy vegetables like romaine, green leaf, lettuce, spinach, and so on. 2. Cooked green leafy vegetables, kale, collards, spinach, and so on. 3. Raw vegetables like cucumbers, tomatoes, peppers, and so on. 4. Cooked vegetables like cooked broccoli and green beans and cauliflower and others. 5. Legumes like your beans, peas, and lentils. 6 would be roots and squashes like potato, yams, pumpkin, squash, and so on. 7 would be nuts and seeds like cashews, almonds, pumpkin seeds, sunflower seeds, and so on. 8 would be cooked whole grains like corn, brown rice, quinoa. 9 would be baked whole grains like whole grain breads. 10 would be low glycemic fruits like berries, grapefruit, green apples, and firm kiwis. And 11 would be other fresh fruits like oranges, apples, pears, peaches, melons, and so on. 12 would be dried fruits like tropical fruit mix, fruit, figs, raisins, and so on. So begin eating foods at the top of the list like salads, vegetables, and legumes, and then start expanding your diet to include foods lower on the list. Each morning before you eat or drink anything, test your blood sugars, keeping track of how your blood sugars respond to foods that you ate the day before. You want to try to keep your blood sugar levels below 90. If your blood sugars are higher than 90, you can fast for the day, cut out the last meal of the day, eat a smaller quantity of food for the day, or eat more of the foods higher on the list and less of the foods lower on the list. Experiment with your diet and what you can tolerate and still keep your blood sugar levels below 90 each day. Why do you want to keep your fasting blood sugars below 90? If you can keep your fasting sugars below 90 each day, you can reverse your diabetes and most of its complications. If you're following these recommendations, but your blood sugar levels continue to be in the hundreds or higher, you may need to take some medication while you work on these 13 steps to reverse diabetes. As your pancreas function improves and your insulin resistance decreases, you may be able to stop your medication in time and keep your blood sugar levels controlled without it. In our next Health Nugget, we will begin looking at the third step you can take to reverse your diabetes, so keep an eye out for the next Health Nugget.